Good afternoon. My name is Dr. Nicole McGrath-Barnes, the founder and CEO of kinderSmile Foundation. Welcome to Tooth Talk. Today we're going to give a tour of the Trenton Dental Home, kinderSmile Community Oral Health Center, Trenton, located at 101 North Broad Street in the center of the beautiful city of Trenton, New Jersey. So come on aboard. So this is our dental home here. To the left, we have our children's area. This is the reception area for our children. And we have the given tree here, and these are some of our donors who've made donations, whether it's monetary donations or equipment. We like to display to show the community that it is a village that created this beautiful dental home for them. Also, if you can notice, the pictures on the wall are actual pictures from our patients, whether it's in the Newark Dental Home, Bloomfield Dental Home, or the Trenton Dental Home here. One of our GBAS providers, that's our Give Back a Smile providers, she decided to do a little reading center here. So she donated these 4 chairs, and we have donated books here for our children. So they can actually walk out with a book. So we're going to come on into our oral education room, and this room was dedicated and donated by the Smith Family Foundation, and they're a local Black nonprofit grantors who pour funds into the Trenton community. So come on in here. And the purpose of this room is simply, as the parents are filling out the registration form, the kids are in here learning about oral education, oral disease prevention. I created a interactive oral hygiene app for them that are on little tablets, but you have to get that from the front desk. So they come on in here and they have oral hygiene coloring paper, things to keep them occupied, and also it decreases the phobia when they go to sit in the chair. So as you could see, it's a nice comfortable room for them. And once again, the pictures on the wall are our actual patients from one of the dental homes. Now we're going to enter on the pedo side, we call it. So this is the door once again. Children would enter this way. The pictures on the wall are our actual patients. Everything was purposely designed to stimulate the minds of the children and to get them excited about being in the dental home and receiving comprehensive treatment. We have a full bathroom here. We focus and we pride ourselves in keeping the facility nice and clean. Typically, in marginalized communities, our children and families are used to walking into dental clinics, dental centers, maybe subpar treatment, or they're greeted at the front desk with someone who's not very pleasant. We pride ourselves on keeping things very professional, clean, and neat for our community. So once they're finished the oral education room, they come here to the toothbrush station. Come on in. And this toothbrush station was donated by First Bank. And this, they really focus on oral hygiene instructions. We believe that education is actually the key to preventing this #1 preventable disease. So we have the toothbrush station. Each of the children will get a toothbrush, and they will leave with this toothbrush. This is also what's called disclosing tablets. This shows how much plaque is on the teeth, so it helps to show them areas of concentration. So also, if you take a look at the oil on canvas, the characters on the wall, this was beautifully designed and made by one of our donors, Marie Whittam, and these characters are the same characters that are in the interactive program that I created in the oral education room. So once they're finished the toothbrush station, here they are in our oral hygiene bay. As you can see, the walls are very colorful, pictures that our children can relate to. Okay, what we have here, we have the reward center. for the children. We have a closed operatory here. We identify the rooms by the color. This was donated by NJM Insurance Group. This is our X-ray room. And now we're going to enter the adult side. So we purposely divided the children from the adult just to give them that separation. The difference is, if you notice that on the adult side, the colors are a lot more subdued. Although the adults love being on the kids side. That's why you may see some adults on the kids side. They just love the stimulation of the colors. But here, the colors are a lot more subdued. So in designing this, I purposely designed it for our children and families in the community where there's more words of affirmation. Too many times we have adults that are going through a lot of mental health issues. And if they can just get a hug or sit in front of something that may inspire them or edify them, you never know how you save someone's life. So as I was designing this is what I had in mind. So as you can see, this is the most important. I always say oral health is truly the gateway to total health. So we're going to come here, and you know the words of affirmation. A smile is the prettiest thing you can wear. Work hard, keep smiling. This is a closed operatory for our adults. And this is one of my favorite. It says, go into the world and do well, but more importantly, go into the world and be good. So as our adults, patients are sitting in the chair, they have an opportunity to really absorb these great words of affirmation. This is a second closed operatory for our adults. This room is utilized by a periodontist. We have a periodontist, Dr. Richard Kahn, who flies in once a month from Boca Raton, Florida, to donate his services and provide free implants so that we, the dental home, can provide the services to our community at a very, very reduced rate. Okay, here's another great saying that I love by Nelson Mandela. There is no passion to be found in settling for a life that is less than the one you're capable of living. So once again, as they're sitting in the chair, they're absorbing all of these wonderful words of affirmation. And here we are. This is the staff room. Purposely designed it larger with lockers so that the staff members can come and really disconnect from dentistry. Sometimes being in the community, it can be a little overwhelming. We see lots of patients that are homeless with food insecurities, mental health issues. So we have to take our employees into consideration, and when they're on their lunch break or just a 15-minute break, they're really disconnecting so that they can replenish. So words of affirmation along the walls. And as we begin to exit the dental home, we have our lab area here. This is where lots of dentures are fabricated and partials are fabricated. When I started, when we opened up the doors in the thick of COVID, I realized that there were so many seniors that would present with no insurance, that worked all their lives in Trenton, poured into the city, and for whatever reason they could not get Medicaid, and they would come in our office with literally no teeth, and which is very unfortunate. So I decided to establish a program called Smiles for Seniors, and that's grant supported, and we want to thank our grantors, Friends Foundation. And we identify 50 senior citizens who don't have insurance, and we give them dentures and partials for free. And this is our resource center here, and then the adults exit here. And if you can also see the pictures on the wall over here, This is our perinatal health and wellness program with all of our mothers in our Bloomfield Dental Home. This is our Arab community of perinatal mothers, and this is our Black community of perinatal mothers. We're grateful for the Princeton Area Community Foundation and the Burke Foundation for helping us to establish this beautiful dental home for our community. This is our resource center. We always feel that it's so important that the adults have an opportunity as they're sitting waiting to be called, can pick up information and read about oral disease prevention. So glad that you can come along to see the tour of our kinderSmile Community Oral Health Center Trenton Dental Home. The tour is over. Thank you so much, and looking forward to seeing you in our next session of Tooth Talk. Bye-bye.